Okay, this is Lauren Allison with naturalindigestionrelief.com, and I'm going to demonstrate how to massage through the colon for constipation or acute constipation to get as immediate relief or relief within 15-20 minutes. So the key thing to remember with this is slow and easy. You don't want to be too aggressive, and otherwise you'll cause the body to tighten up, which it's already doing. So main thing is, remember, as soon as you start, you're always going to start easy, very easy, and starting with low pressure and working your way in. And the colon moves from the right in terms of action to the left, and we have the ascending colon, we have the transverse colon, descending colon, and then the sigmoid, which is the last segment before elimination. You always want to start with the sigmoid, which is right next to the as bone here, the belt line bone. Got it on both sides. Everybody has it. Everybody knows where it is. So we're going to start there, and we're going to start applying pressure slowly, easily. We're going to look for tension spots. Now, the reason we start with the furthest most segment, or the end segment, is because impacted fecal matter, if we start putting pressure on it, or we start pushing fecal matter from where it starts in the ascending and then across transverse, and we have an actual impacted matter here, then we create more by backing it up even more. What we want to do is relieve or take the impacted area and move it closer to the point of elimination so that we have room for the rest of the matter to go. Now we're going to assume we have impacted matter here, and so I'm going to slowly try to move tissue and connective tissue, and we're going to push our sigmoid colon, try to get things moving slowly. And once we're done with that, and basically the end point is roughly the midline or right underneath the umbilical, and we're going to go to the descending part of the colon. And we start moving at its furthest most point right next to the sigmoid first and start moving up. And the reason for that is the same principle that I just described. We always want to create space closer to the point of elimination. And so we're just going to move slowly, pulling down and towards the sigmoid, toward this as bone, and then across. Now, if we have some impacted matter here, we want to make sure we go real gently, make sure that we loosen it up slowly and start pulling it into the sigmoid. And sometimes there will be muscle tension around that, and you have to have the patient inhaling and exhaling as you're doing it, because it releases the connective tissue faster and makes the abdomen, all the muscular tissue in the abdomen relax and the connective tissue. So this is our descending colon, and once we get that smooth, we start moving into the transverse colon, and same thing, we'll be moving, but we're also looking for tension areas where there might be impacted matter. Now, I have a little bit of oil that I'm using from a previous segment, video segment, and so I'm not putting more oil on, but you would use either an oil or a cream so that you get a nice gliding motion over the skin and you're not creating extra tension by friction on the patient's skin. So now I feel some tension in the transverse colon. I'm trying to work through it slowly. If we do have it, then you have some options. You can press into it and hold it, not real far. You want to have them breathe in and breathe out. Try to release it. You will feel it sort of melt underneath your fingers. If it's impacted fecal matter, then generally you're putting some pressure on it and getting it to move a little bit, collapsing it in a respect, and then you can kind of try to move it along. So we'll move further and further into the transverse segment, making sure we're creating space in each part of the segment for matter that we may push later from the ascending or further back in the transverse. So we're moving this over, and it's moving pretty good. There's some tension in there, and we can push into it and hold it. And many times you'll start hearing what appears to be fluid movement or gurgling, and that's because the matter is starting to move through the colon. Nothing to be concerned about. It doesn't hurt. It just may seem a little awkward to the person if they've never experienced that kind of thing before. But that's a good sign because you hear it moving. So I'm moving over to the end of the, or the beginning of the transverse colon. And we seem to be getting some decent movement. And I will start going from the end of the ascending down to its beginning. And I don't feel a whole lot of tension in here, maybe just a little. So I'll continue to move it along. It's unlikely that you'll feel tension in more than one segment. My experience has been that maybe 2 segments will have a little bit of tension, or one has most and the other has a little bit. You just make sure you work through those, get them to soften up. There's a little bit in the beginning of the ascending colon in this case, and so we can, I'm using my knuckle here, but you can use your fingertips if your nails are cut well. And you have them breathe in and out, get it to relax. You'll feel it give a little bit. That's usually the indicator that things are starting to move, or that you're releasing the connective tissue tension around that part of the colon. And once you get that connective tissue tension to release, usually the normal motility or paracelsus is more enabled and it can kick in, whereas the connective tissue tension may have been preventing it from moving properly. This colon is essentially a muscle, smooth muscle. So now what I'm going to do, since I've been around the whole colon, is now I'm going to do a movement around the entire organ in one sweep. And this is basically a clockwise motion. All the way down through the sigmoid, which is basically at umbilical, just underneath umbilical. So we'll go to the ascending, we go up, and we go transverse across. There is some movement, you probably can't hear it on the video, but it's very slight. A little bit of gurgling going on in there, which is good. So we know we're getting some effect here. And I'll go up and across just one more time to get the whole organ in, and down to the sigmoid. And you want complete movements after you've done each segment, and because then we create a nice pattern for the colon to follow as a whole after we've completed each segment. And generally speaking, this will relieve acute constipation relatively quickly, usually the session ends with the patient has to go to the bathroom and relieve the bowel movement, which is a relatively quick process afterwards. Sometimes it may take a little longer depending on how severe their constipation has been, if they're properly hydrated and some other factors. But this is the motion, this is how you do it. You just have to remember to be gentle, go in easily, smoothly, look for the tension spots and release those. You can't be in a hurry, otherwise it won't work at all. So that's the basic premise. If you have any questions, you can email me.